Welcome back everyone after our short break. We're going to move on now to agenda item number 5, which is the Recommissioning Regulated Care and Supported Home report. So I'll ask the officer to present the report, and then after the presentation I'll ask you all to indicate whether you wish to ask any questions or speak by raising your hand, and I'll come to you in turn. Great, thanks.
Thank you very much, Chair. And again, just some very brief introductory remarks from me, if I may. This is a really important report in an area of service, which really is the foundation of community care and really the foundation of enabling people to live as independently as possible within their own homes and communities. The report does two things, really. It talks about our future plans, which I think are really exciting future plans in terms of the recommissioning of care and support at home. But it also highlights for members something that I know you know very well in terms of the current pressures around domiciliary care and retention and recruitment and workforce, particularly in the community, and it sets out the key actions that we're taking in respect of those pressures. So I'll hand over now to Jackie Davis and to Pete Tyson, who'll take you through the report. Thanks both.
Okay, thanks, Chair. What I'm going to do, if that's okay, Chair, is to hand over to Pete Tyson, who's just going to give us an overview of the report, and then we can get into some details then. Thank you.
Thank you, Jackie and Chair, and good morning, everybody. Nice to meet you all. So as Jackie said, what I propose to do is I'll kind of go through the report itself. I won't be going through line by line, but I'll kind of summarise the key findings and pull out the kind of salient points, if that's okay with yourselves. So the purpose of the report, as Claire has already mentioned, we've got unprecedented pressures and challenges in the social care sector, in particular on home care services. So the purpose of this report is to provide the committee with an update in respect of these significant pressures, and also the work that we're carrying out as a matter of kind of urgency and priority in terms of kind of responding to these challenges, which also includes the recommissioning work which is being undertaken for our independent domiciliary services. So if I could draw your attention to section 3, which is the background. So we've kind of set out here, provided a definition in terms of what domiciliary care services are and also short break services. But in summary, these are services that people receive in their own homes, and these are what are registered under Care Inspector at Wales, who are the regulatory body. Section 3.2 onwards then really kind of sets out the work that's already been undertaken within the independent domiciliary care market, and the date of November 2014, when the original remodelling plans were approved by Cabinet. That was actually the first Cabinet report that I wrote when I came over to the Social Services and Wellbeing Directorate. So the paragraphs between kind of 3.2 and 3.7 really set out the journey that we've been on in respect of our home care services and our commissioned home care services, where the balance in terms of the hours now delivered by the independent sector are in the region of about 80%, and we still retain that internal kind of more specialised service, short-term services with our in-house providers delivering in a region of 20%. So paragraph 3.7 there shows kind of where we are at this moment in time, where we have a framework agreement with 15 providers at this moment in time. From 3.8 onwards, that kind of sets out where we are with our short breaks service. And we did a lot of consultation work in respect of this, where we were in the high tide and there were about 100 people in there, both individuals and kind of in receipt of services, their carers, and a lot of providers were in there. And that was really just about understanding what was important to those individuals, who were kind of going to be in receipt of the care, and also those who were receiving kind of the short break themselves. This was independently facilitated by Swansea University, by Nick Andrews, who undertook that. And it was a really, really helpful exercise where what really shone through was flexibility, came through as really, really important, but individuals themselves having kind of voice, choice and control. So what we've done is we've implemented a very similar model, a framework agreement for our short break services, and that's in place at this moment in time. Paragraph 3.11 mentions a recent Care Inspector at Wales. I mentioned the regulatory body for these services. They came in and they really kind of commended us on the approach and the model that we had in place with the short break service. Section 4 now, this kind of really provides the context and the challenges that we're facing at this moment in time. So the first table there into 4.1, that kind of highlights typically how hours have increased for our kind of care at home services. It's very much in line with wellbeing objective 2, which is helping people to be more kind of self-reliant, living as independently as possible. But the figure of about 8% increase over the last 3 years, that's very much in line with increasing dementia rates and the aging population that we're all well aware of. But that equates to about 2.5% kind of on average per annum is what we've been used to dealing with. Paragraph 4.3 kind of sets out how these demands have just increased exponentially kind of since the impact of COVID last April. So we can say we're looking at kind of demand increases in the region of kind of 7 to 8% just in 18 months since April 2020. So this really shows that already we've had significant increases in demands on these care at home services. Paragraph 4.4 also kind of sets out how these challenges are going to be increasing kind of going forward. And this links to the Welsh Government report about a rehabilitation framework that's in place, which is intended to kind of help assist us as kind of planners and care providers in terms of planning for future years. And they've set out the 4 main areas where they do see these demands increasing still further. So one of these is linked to kind of the longer term effect of those individuals who've had COVID. There's the people awaiting kind of paused and urgent routines who have had kind of further deterioration. Third aspect is people who may have avoided accessing service during the pandemic. And then the fourth key element is those kind of socially isolated or kind of shielded groups where the lockdown has decreased their levels of activity and social connectivity. So in short, what we're experiencing is significant increases in demands and pressures on the care at home services. The next part of the report kind of that takes down, so kind of paragraphs 4.6, 4.7 and 4.8 kind of identifies how our ability and our capacity to meet these pressures and demands are really getting stretched. There's a range of factors in place in terms of how our kind of supply and capacity to kind of meet these challenges are really getting hit. There's the competition from other sectors, such as kind of hospitality and retail, and also possibly some unintended consequences of recent regulation and kind of legislation that's come into force. Key one of these is the regulation and inspection of the Social Care Wales Act. And as part of this, there's significant training and qualification requirements and also continuing professional development. So it's a big ask on the kind of care workers who are coming in, who in reality aren't paid much beyond kind of at this moment in time, kind of the national living wage. So what that's doing is that's really impacting our ability and our capacity to meet the pressures and challenges that we mentioned earlier on in the report. So the next section then is how we're responding to these challenges. So a project group has been established, and this is chaired by Claire as corporate director, and it includes officers from a range of services across the council, really. So what we've been tasked with is developing, implementing and monitoring an action plan, and this has been appended to the report as Appendix A. But in summary, there's 3 real key themes that are kind of coming through and the kind of within that action plan. First one being how we kind of manage the demand. This is how we kind of regularly kind of assess and undertake a risk-based approach for those kind of already receiving care and those who are requiring care and moving forward, and how we kind of utilise direct payments, which in effect is providing individuals the means by which they can commission their own care and support via a payment that is made directly to them. We're also looking at how we can maximise capacity. So this is through kind of effective recruitment and retention, both of our in-house services and also the commissioned providers as well. And also reviewing our service model, so how we can be as innovative as possible in terms of how we deliver these home care services. Again, going back to what I mentioned earlier on the feedback from the events with individuals themselves about that flexibility and voice and control. So the move towards a more kind of outcome focused way of commissioning has been approved by Cabinet, and it went to Cabinet in July 2021. And again, as I mentioned, this is all about a more outcome focused kind of way of working where there is greater kind of flexibility, voice and control within that. As part of that, we did a market testing event with a range of our providers, both our existing providers and also potentially new ones as well, who could come into the market and support us as well, where they were all really complimentary about the short breaks model and about the approach that we were looking to undertake. So we've gone out to market now, and paragraph 417 kind of highlights the key timescales within which we're looking to have these new commissioning arrangements in place. So as I say, we've already had the cabinet approval. The tenders have now been placed, and the tenders will be returned now in October, where we'll be undertaking kind of interviews. There's a real rigorous process by which we want to ensure that we have real kind of high quality standard providers working with us. So that evaluation process will kind of be carried out during kind of October and November, where then we'll be going back to cabinet in December requesting approval toward these framework agreements, with those arrangements starting in April 22. The next part of the report really kind of focuses on the pricing element of the tender, where feedback from providers, how we've historically gone out to the market, is said that this is the service we want you provide. Will you give us rates to deliver these services? And it's often been criticised that can be a bit of a race to the bottom. So approach that we've undertaken now, so we've worked very closely with the National Commissioning Board, who have been working on behalf of the Welsh Government, and they've developed a kind of toolkit and a report within which some rates have been defined in terms of what a fair cost of care is for the market. So we've been a bit creative in terms of how we've gone out to the market. So we're kind of providing these ranges within which the providers can bid. So this links to, like I say, the National Living Wage and the Real Living Wage, and links to that National Commissioning Board work. And this pricing schedule concept was tested with the providers at the market testing event, where they were really in favour of that. So as I say, we're in the middle of that procurement process now as we speak. So in terms of section 5, CPR, so the tendering process is being undertaken in accordance with CPRs and the quality impact assessment. It's no detrimental kind of impact to any of those individuals we're supporting. In respect to the well-being of future generations, this is an absolutely vital service, as Claire mentioned earlier on, enabling people to live at home. So that long-term prevention, collaboration is absolutely important, where we're working with wider stakeholders. So this involves our integrated services, so our integrated kind of health and social care teams, individuals themselves, families, and the wider communities as well. So those are really, really important facets of the new service model going forward. Under section 8, the financial implications, the cost implications of developing these outline plans that we've kind of mentioned earlier on and that are detailed in Appendix A. These are being worked up with our finance colleagues as we speak. And this is where kind of funding linked to the Welsh Government Social Care Recovery Fund, the 1.7 million that's been allocated to BCBC. So this is all being kind of, as I say, worked up with colleagues in finance and in respect of that. So with regard to the recommendations, it's recommended that the committee considers the contents of this report and also provides any comment on feedback on kind of the plans and proposals that have been kind of worked up as part of Appendix A. Thank you.
Thanks very much. Jackie, did you want to come in on this, or?
No, not at this stage. I think
right.
It's it. Yeah, thank you.
Okay. In our pre-meeting, I think Councillor Clark had some questions. First one with regards to the tender process. You want to come in, Councillor Clark?
Thank you, Chair. It was a general question, if you like, because what it said within the starter report was that you'd undertaken a tender process. And I understand the issues around, sometimes it doesn't work out, sometimes it's challenged and whatever. But I wondered, it's quite an expensive process, and obviously you wanted the service to be organised a lot sooner. So I wonder what if you like, rather than the detail of what might have gone wrong, I just wonder what sort of lessons were learnt in terms of tender processes in the future.
So Pete, are you going to give the details of this? Yeah. So I presume you're relating, Councillor Clark, to the previous tenders that we've done and the lessons that we've learned going forward. So yeah, thank you. Thanks, Pete.
Yeah, thank you, Councillor Clark. So when we undertake these tender arrangements, we're commissioning what are titled kind of official frameworks. And with those, there's a maximum time duration that you're able to enter into contracts. So each of these tenders that are previously undertaken have a maximum term of the 4 years. So we're coming up to the end of that 4-year period now. So we have to go back out to the market. But every time we've gone out to tender, what we've done is we've linked in and kind of engaged with the providers, those who receive the support. So all the time we're kind of fine tuning. So apologies if it didn't come across quite like that in the report, but ultimately, so nothing's gone wrong with previous tenders. So all the time it's just been in line with the contract end dates and the time limitations within framework agreements themselves, which is the reason why we've had to go out to the market each time, and it runs in 4-year cycles. So we will be doing the same in this instance. So the contracts will be entering into a 2-year contracts initially with the option to extend by up to 2 years, but you're enabled to extend beyond that, and that links to overarching public contract regulations. So this is legislation that's set into UK law ultimately. So our hands are very much tied in that regard. But no, nothing's gone wrong with any previous tenders, and we do take the learning from each one. So hopefully we're fine tuning and we're continuously improving as we're going along, hopefully.
So it was very much a technicality then?
Yes, yeah.
Thank you. Thank you, Chair.
Right, you happy with that?
Yep, thank you.
Okay. We had a question in the pre-meeting from Councillor Gebby. Now she had to leave at 11 o'clock for another meeting. So if I read out her question, how successful has the recruitment drive been in relation to home care? And if I can jump onto that, then it's something I also raised in council last week, is what happens if we can't recruit? What's our worst case? Do we have backup plans? Because obviously everyone else is trying to recruit as well. And in every scrutiny meeting we're having at the moment, our concern is lack of people out there, skilled people or people wanting employment. So thanks very much.
Okay, I'll start this one then, if that's okay then, really. And I suppose in terms of home care, you know, managing the whole process, particularly throughout the pandemic, our recruitment is ongoing. And there have been periods over the last year where we've been quite successful. But what's happened in the recent, probably last 6 months, is that we're only getting 1 or 2 applicants for all of our recruitment that's going on. As Pete's explained and as detailed in the action plan, we've got quite a robust action plan, particularly around recruitment, and there's been a hive of activity over the last couple of weeks in terms of the drive. So our attendance at the jobs fair, there's lots of social media that activity, and our marketing colleagues within the council have been driving that. So it's a continuous process really, and we continue to be hopeful that we'll be able to recruit into those roles. We've been producing videos of people currently in the service and using, you know, and this is the national campaign that's been happening that members were told about in council last week, really. You know, the question about if we can't recruit is probably very difficult to answer one way or the other. All I can assure members is that on a daily basis at the moment, we continue to look at our current situation and deploy resources to those most in need in our prioritisation. So as in the action plan, we look at our risk-based approaches to ensure that people are having their care and support needs met, really. You know, the action plan up and, you know, we were meeting up until this week on a weekly basis to take those 4 key things forward. It's absolutely a priority for us in terms of directly provided services, to the support that we give to our IDCs and to our social workers that are managing the process and you know, and liaising with individuals and with their families, really. So we continue to work with other partners, and we continue to, you know, such as the health board and with our third sector colleagues, and we continue to look at innovative ways to ensure that we meet people's, you know, care and support needs, really. So so Claire, I assume you wanted to come in at this stage as well.
Only just to build on slightly, Jackie, in terms of the in terms of how we support people when there is a delay in having their assessed needs met. So probably I would highlight like 3 things. One is that most people, and we've got the exact figures, who are waiting for a domiciliary care package are actually getting their care needs met in another part of the system. One of the biggest challenges that we've got at the moment is the number of people who are delayed, not in hospital, but in our reablement services, our short-term services, whilst they're waiting for the care and support in domiciliary care in the community long-term to become available. So that most people get their needs met in another way. We do actively offer direct payments, and that was the bit that I know Jackie's been leading for us and just wanted to add in, and trying to use that very flexibly. So if individuals and families themselves can identify somebody, often in their wider support network, who is able to provide direct payment, care and support on their behalf via that direct payment route, then that is something that we have been working to sort of fast track through the approval of that direct payment and the recruitment of the personal assistant. And then the third element, just to highlight, what we're really trying to build up even further is informal carer support. What we're not seeing at the moment, we do have capacity in our in-house residential reablement service, Brynacai, and so if people's needs became too great that we couldn't safely support them while they're waiting in the community, they would need to step up into some other provision for safeguarding purposes. But we're not seeing that happening really very much at the moment, despite all these challenges, and that's because informal carers, family carers, are clearly taking on some of the care responsibilities whilst care is being put in place. So one of the things as part of our recovery plan we're really looking at is how we can get even more support into informal family carers. If there is a delay, say, of 2 weeks, and that's just an example time period, how can we support you as an informal carer to keep going whilst there is that delay? So I just wanted to highlight that there are things that we can do practically. It's not optimal, but we would never not have oversight in the sense of where an assessed care need is waiting to be met.
Thanks. Can I just come back on a couple of points you raised there? With regards to the direct payment, how do we safeguard vulnerable patients to ensure that family members aren't taking a payment and then not providing any care? Is that anything we monitor to ensure that the care is being provided? And when you mentioned about utilising care elsewhere, I've had a couple of referrals in with regards to Ysbyty Seren, where you've got the opportunity to have patients looked after there before they return to the home. And I know there's been a delay with a number of patients leaving there. On that basis, are the health board at all just discharging any patients and then we're left then with them at home as well, or are they all maintained within this setting so that at least there is some element of care and support for them? Or are we seeing any patients being discharged from a hospital setting or a Ysbyty Seren when there is no care package in place? Are we all working together to ensure that those patients remain in that place until there is a care package? Thanks.
Shall I take this one, Claire? Yeah. Okay, so just to provide reassurance really to the committee, we've got integrated services that you'll be very, very familiar with here in Bridgend, and part of that integrated work is around the discharge liaison really, and there's a very robust process really in terms of referring into social care, referring into those reablement type services, and then ensuring that people aren't discharged without their care and support needs being met really. So on a weekly basis there's a very detailed meeting that takes place with all the individuals that are currently fit, that are medically fit but not ready for discharge, and then there's a whole process that we go around that. If in the unlikely event that we do have a discharge that we're not aware of, there's again an escalation process for us to highlight that very, very quickly really, but those incidents are very, very few and far between for us here in social care, so in Bridgend. Okay.
Thanks.
In terms of the,
sorry, yeah, carry on. I know Councillor Hugh David wants to come in as well on this. Thanks.
I was just going to say around the direct payments process, you know, we've got a direct payments team here in Bridgend that carry out a monitoring function, but also we've got social workers that are engaging with individuals really, and that, you know, I am not aware that we have incidences where people are, you know, what you're describing really, people that are having the money and not providing the care. You know, we've got quality assurance measures in place in order for us to pick that up if that happens, and to pick that up in a very timely way really. So yeah, okay, thank you.
Thanks. Councillor David, did you want to come in now?
Yeah, thanks, Chair. And I think it's right that that question is asked around direct payments, because if you didn't know how it worked, then on the surface it can sound like a risk, but we do have a number of safeguards in place, as Jackie has described, around the social worker that is supporting that individual. But also we can actually commission and people in receipt of direct payments can commission support to help with the administration of direct payments. That's still the case, isn't it, Jackie? And that is often used by people because there's also national insurance and tax implications, obviously, around paying for your own care. And whilst that's primarily about supporting individuals with that aspect of it, it also is another safeguard then in terms of ensuring that payment is used in the way that it is intended, and that's been a long established mechanism for direct payment. I wanted to respond to your point around the recruitment difficulties we are experiencing. It doesn't make the problem any easier, but just I thought I'd outline that it's a regional problem, it's a nationwide problem. So Claire can confirm that every local authority in Wales is experiencing a similar problem to Bridgend. Indeed, some local authorities are experiencing an even greater problem around recruitment. And what that does mean is that Welsh Government are looking at this very closely currently. In my role as spokesperson for health and social care, I am now meeting with the Minister for Health and Social Services on a weekly basis, and a range of options are being considered to help with this recruitment problem, because it is an acute problem presently that's been caused by quite rapid changes in the labour market as a result of the pandemic, as a result of COVID, and that is a real challenge for all of us, because it means that other parts of the labour market have changed their terms and conditions quite quickly, and therefore we are looking at what we can do at a local, regional and national level. And that is why we'd already made the commitment around the real living wage, which is higher than the statutory national living wage, because we recognise the need to improve terms and conditions for all workers in the care sector. And you asked this question, didn't you, Chair? And I'm glad you asked the question in the full council meeting last week around what can members do, and anything members can do to promote social care as a profession, as a choice, as an option through social media or any other channels would be appreciated. Because I was having a conversation with someone only on the weekend, and they were very surprised to hear that we were struggling to recruit. So not everyone is aware of that, and they were thinking about social care as an option, and that's why we'd really appreciate members helping in any way they can with that aspect of it. And obviously we will report back as well to colleagues on the actions that are implemented at a national and regional level following the work that is being undertaken at the moment. Thank you, Chair.
Thanks very much. I know that Councillor Clark has got a question on staff costs, but if we go back to Pete first, I think you've raised your hand to speak.
Yeah, thank you, Chair. And it's on the point of recruitment and retention. So just from I guess the commission provider perspective, so we have regular meetings with the providers, very much about kind of supporting, sharing information, etc. So we've asked them. I said, if I had a magic wand, what would be the thing that you guys ultimately need to help with recruitment and retention? So we're working very much kind of with the providers collaboratively, kind of taking suggestions and sharing those ideas. So it is very much a whole sector approach to this. Feedback I'm receiving is one size doesn't necessarily fit all. So one provider said an extra £2 an hour might really help. Another provider said it might look a little bit different. So we're taking all that feedback, and that's all getting fed into these plans, as Jackie and Claire have mentioned earlier on. So all that feedback is coming back in, feeding kind of how we're responding to the challenge, which is very much, like I say, working jointly with our key partners.
Great, thanks very much. Councillor Clark, did you want to come in with your question on staff costs?
I'm fine now. It's been covered during the general debate. Thank you, Chair.
Right. OK, I've got a few questions that have been sent to me, but has anyone else got any questions first of all before I go into those? If you want to put your hand up. No? Apologies now, I'm changing my screen, so I won't see if any hands go up for the moment while I ask some of these questions. Paragraph 3.2, page 37, says the remodelling home care implementation plan in November 2013 recommended remodelling the council's internal home care service into provider of specialist home care services and commissioned domiciliary care services from the independent sector. But the report doesn't mention whether the internal home care service has been remodelled into a specialist home care service. And if so, what specialist provision? So if you could answer that one first, please. Great, thanks, Pete. Oh, Jackie's good answer.
Yeah, oh, sorry, yeah, Jackie would cover it much better than myself, I'm sure.
Okay, so back in 2014, it seems such a long time ago now, really, doesn't it? And we did actually go through a remodelling programme. It took about 3 years, and now we do describe our in-house services as specialist home care services. And what that means is that the level of complexity that our in-house team are able to support is greater than what we deemed at the time as general home care. Now, since that time, really, there is a bit of blurring really about what is a specialist home care. But if you think about people that have a significant care need that we're supporting in the community, so for instance, it could be somebody that needs double handling 4 times a day, 7 days a week. Those are the packages that our in-house team would support.
Okay, thanks. I'll go on to the next question. Page 38, 3.9, it's still unclear what the short break service is, and it would have benefited from some examples of what it would be used for, why someone would want to bank weekly assessed hours to use in a 4-week window. Thanks. Okay,
I'm going to ask my colleague Pete really to give you the details of some of that, and then we could come in with some examples, Pete, if that's okay, about the banking and stuff, yeah?
Yes, yeah, no problem at all. So with the short break service, I think a key definition is that that there's an individual will receive the service from our regulated provider, but there's also somebody who might be an unpaid informal carer who will receive benefit as well. So is for example, a family member who might day to day provide the bulk of the kind of caring responsibilities, but they require, and I guess as the title suggests, a short break themselves. So what we will do is we will commission a provider to go in and provide that care to those individuals, to allow that the person who usually provides the care a short break. Sometimes it's called respite, but that's kind of in effect what that service is. So we have different forms of those services that are available. The one of particular focus of this report is where the care actually goes into the individual's own homes themselves. So the person who usually cares might go out, they might have a day out, an afternoon out, go shopping, whatever they need to do, I guess, in terms of their own downtime. But then we also have more kind of respite services, which is where the individual will go out of their own homes, and ordinarily then is entering into, it's normally a care home setting, and then the person who usually provides the care has a break kind of with the individual outside of the home then. Is that okay?
Yep, great, thanks. Jackie, do you want to come in now and finish off? So you're on mute.
Can you hear me now?
Yeah.
Yeah, sorry about that. Really, just to add, really, you know, part of our assessment process and part of the outcome focus work that we, you know, in our strengths-based approach that we've talked about in Scrutiny previously, really, is about what matters to that individual, really, and for the family setting, really. So it can be a whole array of things, but it's about what meets the needs for that individual. So as Pete said, it could be somebody that needs an hour every week to do shopping, but actually every couple of weeks they might want to save those hours up and then go out for the whole day. Or it could be somebody that was going on holiday abroad, for instance, and they save up those hours in order to be able to do that. So again, it's very person-centered, and it is about the situation in that household, really. So yeah, and we've had great success of it, really, and working with families. There's a lot of creativity that's happened. So, Pete.
Thank you. Yeah, I was just going to elaborate on a point about the banking of the hours. Apologies, I missed that off with the original question. But what we've got is we've built it into the contract and the specification about the ability for individuals to bank those hours. So it's over that 4-week period, and it's for exactly the reason that Jackie said. It allows flexibility. Historically, it was a case of, okay, you're getting allocated these hours, and it'll be, for example, Thursday at 10 a.m. every week. So now it's a case of the provider, individual families, they can have those conversations. And this goes back to the feedback from that provider event we had, where we linked with individuals, the people who care for them as well. And it was very much about, can we just have a bit of flexibility and a bit of voice and control over kind of what happens to me, what matters to me ultimately. So that was what we've really kind of incorporated into our specification. And that's really how we try and work with our commissioning arrangements going forward as well. It's all about that enabling voice, choice and control and flexibility.
Great, thanks very much. I've got 2 more questions. In page 39, 4.4, is there any modelling yet on the projected increased demands due to the 4 areas listed?
I think, Pete, you picked that up in terms of the sort of 8% that we're seeing at the moment over this last while, didn't you? But I think in terms of modelling going forward, we do need to do some more work around this. I'm seeing lots of modelling as part of health board meetings in terms of sort of COVID impact over a period of time, and we usually would see that need coming forward into ourselves about 4 weeks after somebody's been admitted into hospital, for example. But I was looking at a report yesterday showing quite the level of deconditioning, if I can use that word, of individuals in the community who are older, and the lack of physical activity and the impact on physical health as well as mental health, but this was the focus on physical health of that extended COVID lockdown period. And I was really quite taken aback by what may be facing us in terms of increased need and demand, not just in the short term linked to some of the challenges we've got at the moment, but over a longer period of time. So I think there needs to be some more detailed needs analysis and pieces of work to really understand the impact of that. You know, people who can't climb the stairs anymore, for example, you know, who were able to climb the stairs pre-COVID, they might not be coming to us yet, but in the next year, 18 months, their physical health, if we don't get in early and support in different ways, may deteriorate to such an extent that they would need care and support at home. So I think we're understanding perhaps the current impact and how that might look, but I think there's a medium and longer term impact we need to do some more analysis around.
Great, thanks very much. Final question then on finances, and in 8.1 the cost implications of developing the proposals are not yet determined, and what if they exceed the 1.776 million allocated to BCBC? Also, additional pressure may be placed upon the budget beyond 21-22 as social care recovery grant is only confirmed for the 21-22 period.
Yeah, I think that there's two things here really, aren't there? And we picked up some of the issues in the earlier scrutiny around early help and permanence, because there are significant elements of grant funding that we're using to offset pressures in adult social care. So if we think about our intermediate tier services, our reablement services, they benefit significantly from Integrated Care Fund, and we're awaiting new guidance on what that will look like going forward. When we took the report to Cabinet, which was approved in July, it talked about use of the social care workforce grant, which is grant funding we've had over a number of years to address pressures, but you know, we never are 100% confident we're going to get that into future years. And then the social care recovery grant referred to in this paragraph is money that we're having just for this financial year to support recovery. So there's both the unit cost, isn't there, which you know, to pay a fair price of care is set out in the report, and then there's the increased need and demand as well. So I think a lot of this will link to national and Welsh Government decisions and how money that coming into Wales will be made available in terms of delivering this, you know, increased need for social care that we are seeing. But it's a significant pressure for any council and for Bridgend Council as well. And I know BREP have asked for some information which we're taking to the next BREP committee as well around commissioned services.
Great, thanks very much. Did you want to add anything, Jackie? Oh, I know. Oh, Councillor David, do you want to come in?
Yeah. Thanks very much, Councillor Williams. Only to add that we continue to make the case to Welsh Government on a weekly basis around the need for additional sustainable long-term funding for social services. We're very, very pleased to hear the announcement around ICF, because that does support a really important part of our reablement and intermediate services that support people that are discharged from hospital and keep them out of hospital as well. But also we were pleased to see the announcement around potentially additional funding for social services in Wales following the UK government's decision around the levy. What we need to make sure is that as much of that funding as possible is committed to social care, because the levy is for health and social care, and the risk is, and we're seeing some of this in England, is that the lion's share of that funding goes to the NHS, and once it goes to the NHS, I don't think there's any chance of it coming back again to social care, even if it's committed to the NHS on a temporary basis, a short-term basis. And I think that's the indication in England from the UK government. I've never seen the NHS's budget ever being cut, so I don't think that's going to be given to them and then given back to us in a couple of years' time. But we are continuing to make the case here in Wales, and no decisions have been made yet, because obviously announcements only just been made around the additional funding, which is welcome. So on your behalf, we continue to make that case to the Welsh Local Government Association, and will of course keep members informed of developments, and no doubt it will be part of our medium-term financial plan and strategy as well, which of course will be considered by members in the spring. Thanks to all.
Great, thanks very much. So I can't see any more hands up with questions. So if that's the case, then the committee is requested to consider the recommendations of the cover report set out in paragraph 9.1 on page 43 of the agenda pack. So do you have a mover for the recommendations?
Yes, I'll move again, Chair.
And a seconder.
I'll second again, Chair.
Thanks very much. Thank you, officers, for attending to go through that report and answer our questions. If you want to leave now, you're more than welcome to. And then we'll move on to item number 6, which is the Forward Work Programme update. Right, okay, Tracy, do you want to present this report?
Okay, thank you, Chair. The Forward Work Programme update begins on page 49 of the agenda pack, and following on from members' consideration of at the previous meeting on the 15th of July, the Forward Work Programme is attached as Appendix A on page 55. This Forward Work Programme, with any updates from the committee, will be reported to the next meeting of COST in October. The recommendations, monitor and action sheet for the previous meetings are attached as Appendix B on pages 57 and 58, and tracks the responses to the committee's recommendations at the previous meetings. And the recommendations are set out in paragraph 9 on page 54. I'll hand back to you then, Chair.
Right, okay, thanks. In the pre-meeting, nobody had any concerns with the Forward Work Programme. If you have now, if you weren't at the pre-meeting, if you want to put your hand up. I think the only thing that was raised is at the next meeting, we're going to be looking at staff sickness and staff well-being. And I raised that I'd like to make sure that the statistics that are coming to us aren't just the last month's level of sickness. We need enough we need enough information that we can see if there's any trends. So it's just to make sure that the Directorate do bring us enough information, because it'll be interesting to see what's happened during COVID, because obviously that will play a part in sickness absence as well, with isolating and all of that. But if nobody else has got any other points to raise on this, then we're requested to consider the recommendations of the cover report set out in paragraph 9.1 on page 54 of the agenda pack. So is everyone happy with that as it stands?
Yeah.
Yes.
Great.
Chair, I'll make a note of what you've just said and make sure that's fed back to the Directorate, okay?
Great, thanks very much. Then item number 7 is urgent items. There are no urgent items to discuss, but are we going to look at now? We've got obviously the 2 reports that have come through. Have you picked up anything out of those 2 reports that we need to look at and consider?
There wasn't any in the first report, Chair. I think Councillor Clark picked up on the fact that he'd asked about information regarding the different nations. So just bear with me, I'm just going through my notes. But I think Councillor did say, I think he asked, is it the same approach taken in other nations in terms of grant funding? And I think Councillor Clark may have said that he was happy with the response, but we can go back and ask for information if so, if you'd like us to. I'll leave it entirely up to you. Leave it at members' hands. I
was entirely happy with the response. It was trying to set something in context, and it wasn't about finding out the information specifically. Thanks a lot.
Yeah.
No problem. I think that was it for the first. I think, as you said, with the first meeting, everything was answered.
The questions, I think the answering was far better than I'd ever seen from a scrutiny meeting. The quality of the responses was excellent, I thought. And we had the statistics. In the past, we haven't had statistics, we haven't had figures, but the figures were provided, I think, on every answer. So that was really welcoming.
I haven't really picked up anything specific. I know the leader just said now about looking at longer term and implications. So I don't specifically have anything. So it's whether members wanted to bring up anything that we can ask.
Personally, again, I think that all the questions that were put forward were answered, but unless anyone else has got any other comments or anything they didn't feel was answered in full, then no hands going up. But if that's the case, then I think there's nothing else on the agenda, is it? Oh, sorry, Councillor White.
Next month's meeting, next meeting on the work sickness records. Could we ask about work-related stress? Because I think as a duty of care counsellor, we know that a lot of our members of staff are under a lot of pressure, especially within the social services, which has always been an issue. I'm just wondering on work-related stress, if we could maybe emphasise on that as well.
If we can have a breakdown on the types of sickness absence would help as well, because I think COVID is going to skew the results as well, because there will be people naturally isolating, naturally off work because of that as well, which wouldn't normally have formed part of the sickness reports.
I think maybe we should go back to maybe like 18 months really, because as you say, we get a false impression over the last 18 months with COVID.
Yeah, and I would have thought stress, particularly work-related stress, would have come from COVID itself as well. And yeah,
that's fine. I'll make a note of that, Chair, and I'll add that to the other one as well.
Okay, well, if that's the case then, and there's nothing else, did you want to come back? Sorry, Councillor White.
I just say thank you, Chair. That's all. Thank you.
All right. Okay, if there's nothing else then I'll draw this meeting to a close and thank everyone for their time. It's been a long meeting, but thanks very much.
Thank you, Chair.